So once I align my to my IR, I should not worry about it. Okay? So which one would you guys would like to start off with? Should we follow the
Yeah.
the-
Sorry.
So we're gonna be doing the AP femur. Hello, hi. Thank you for coming in. What happened to you? I broke my leg. Okay, so I'm gonna get a shield because we're still gonna be, basically when you're working with the patient, I want you to think of dividing the patient in half, okay? So just by eyeballing, I'm gonna place my shield half because I don't need to be working on that side. Your landmarks for this will be the aces. Can you guys all find your aces here? When you look at for the aces, make sure that you feel for the bump and then down, because some people feel this here, that's not your aces. Your aces is right here, the most prominent point here. So when you work with the patient, you have to tell them, ma'am, I'm gonna look for this bone that is sticking out here. Can you point out to it what that is? Either they point it out and you just cut, can I touch? And see, you start from the side in. This is a very touchy area, so you don't just wanna be like here. You wanna start from the side and then find the aces. Once you find that, you are going to have your margin of your collimation, the superior margin, right at the aces, which we call it for easy reference, top of the light. Okay, so we're gonna do the femur. The femur, unfortunately, we don't have a IR long enough that will include the whole entire leg. We either gonna do the longest film closest to the site of injury. So let's suppose that this person is hurting closer to the knee joint, okay? So if the injury is back over here, then it makes sense that I want to include most of it because I don't know if the crack will go down that way. So I want to do the longest film first. This is our aces. There you go. Okay, so similar to this. So my longest film will have 17 length and about 10 inches wide. And you will have something like that. May I have a marker from over there?
Left.
This will be the right. So for your AP, you want to have your legs standing up that way or rotated inward just a little bit. What do you guys remember?
Rotated inward,
Right, about how much?
10 to 15 degrees.
And what happens is when it's just relaxed like that, the trochanter kind of hides back a little, so when you roll the leg in, see what happens? Now you get the neck nice and stretched out. See that concept? So there you go, you'll have that, and you will have your marker right at the end of your margin here, at the bottom of the leg. Why am I doing that?
So you know you're overlapping with your.
Perfect. Someone said this morning, well, why? I said, because the radiologist is not here to see. Okay, Ms. Sherman, I just got it. I know
Sorry,
this is your last
okay.
one, so.
I know we were working on the website and all of a sudden it was 2 o'clock.
Yeah, so basically I just said, the long film first, and then that's what I said, marker placement.
Okay, so you started at proximal, you haven't done distal yet?
Yeah, no, that's
Okay.
the first thing.
All right. I'm gonna take this one ovary over here. Sorry, she had to go to lunch, you're all done. So we're gonna start from the aces down, and then we wanna collimate just a little bit, because we don't wanna worry about the side stuff here, right? And what was that little trick?
Good afternoon, everybody.
You
know this is my last class. We know.
Oh.
Glad
Okay,
to
so,
be here.
huh?
We're happy to be here.
So remember, we're gonna line this up with the ear, so we don't have to worry about any extra padding over here, right? Relax. And then before we make our exposure, what's the last thing we have to do before we walk away?
Roll
Roll the feet.
Right, so we're rolling the feet in to get the neck parallel to the IR and the trochanter profile. So what I suggest is, well, I'm gonna get you, so one way or the other. We need like a couple blocks. I used to have a nice little square block in here, but I'm having trouble finding
I
it.
think it's, let me check if
There's some down there.
Yeah, it's okay. We can use this probably. All right, so you want to have something between the feet far enough to keep the heels from sliding together. Sometimes a tissue box will work, because oftentimes when they have shoes, when you put their feet like this and roll them, I've had patients that keep sliding their heels together. So you want to keep them about a foot apart, and that allows the toes to roll together. If you don't have the feet far enough apart, and then you try to roll the toes, see how it's not enough of a, oh good, Garrett, see, I knew we had one. See, Rosa knows everything. So, this is probably a good distance right here, so go ahead and bend your feet up so they can see them rolling, and then roll the toes in. So how much do we rotate the feet?
15 to 30.
Yeah, 10 to 15 degrees, so 15 is a good guideline. And just by putting the two toes together, it'll help her keep that position. Then when we're, if we were gonna go from the knee up, so if we were just doing the femur, then of course we would come down here and collimate to 10 by 12. Oh, she's not in a good place. I gotta move the bucket down a little bit. Because I can't, I wouldn't do two 14 by 17s, right? So if I was doing a femur, I would do a long film and then a short film. Everybody got that? But if I came in first and was just starting with the femur, I'm gonna do a full 14 by 17 or like, not 14 side by side, but 17 lengthwise. So your card's gonna say distal or proximal AP femur. So if it says distal, you're gonna start from the distal end, go to the apex of the patella and go up. And then do the same thing, but make sure that you have the marker at the top so it shows overlap, okay? And then we're gonna do the same thing. Roll the toes together, but not as much. I'm gonna just make sure that the condyles are parallel. So I'm not gonna like really get severe with the rotation, but you do wanna make sure that the condyles are parallel here, okay? All right, now, whoops, watch out. Push that behind you so you don't do that again. All right, so that's the AP femur. Now for the lateral, I'm gonna start with the, over the top lateral, and then we'll go back to the hips, okay? All right, so for the lateral, I'm gonna get this stuff out of the way. What am I gonna need? A big sponge. That big blue one. Or actually, that green one on the top is good. Yeah, something enough to just have her rest her knee. So I'm gonna have her move away from me a little bit. This table's nice and big, so you can do that. Okay, roll over towards me. Push your leg back here. Okay, and then bring this leg up and over. So you wanna give her something to relax her legs. See how that leaves her legs level? If you don't give her the sponge, see how it brings the hip down? And it tends to over-rotate the hip and over-rotate the knee as well. So giving her this sponge, and this works when you're doing a lateral knee like we went over last week, right? Okay, and then you can go ahead and get the shield sort of in place and then fine tune it before we finish. Okay, so I want to make sure her leg is kind of straight up and down. That helps with our centering and coordination. Here, so just like before, if we're doing the distal, we're going to go from the patella, apex of the patella up. Now see how I have light over the shield here? So a couple things. Remember, we don't ever want to have light up here like it shows in the book and on the PowerPoints, how they have light here, especially for males, because that's where the boys are going to be, right? We don't want to put primary radiation right there. Go ahead and bend your knee just a little bit. So you want to get that soft tissue up out of the way. But you want to collimate down to where you're not going to get any radiation in this area. Because there's no way that you're going to get any information there anyway. Did she detect this? Can you scoot towards me just a little bit? Your whole body? Yeah, just a little bit. Okay. Okay, so now I'm going to put the shield here. I'm going to kind of, can you bring your hand up and hold that? Good. So see how I'm kind of wrapping it around her body? So it's still shielding her, but I don't want it billowing out like this and covering up part of the anatomy. Got it? Okay, good. So now we're covering the goods protecting the gonads, and I'm gonna bring the collimation down a little bit. Because this is only a few inches from the hip joint. We're gonna clearly show that when we do the lateral. Everybody good with that? Okay, so you've got the patella apex. I try to bring her leg up and down as close as possible. She's a little bit angled, so I'm gonna just turn the collimator just a little bit. And then this would be a good spot for my marker right here. Side to side a little bit more. Okay, and see how nice and lateral she is? Her knee's lateral. Now what's the difference between this and a lateral knee? What's the major difference besides our centering? It's not over the knee. The inflections are probably about the same. She's maybe flexed a little bit more, but
It's the rotation.
yeah, the angle. So not only are we not angling up, but remember there's a 5-degree divergent beam in the tube. So by the position of the tube here, we're actually throwing this upper medial condyle down. That's why if you look at the image there, see where that one condyle is lower? The medial condyle is even projecting it farther down into the joint. But that's okay, we're not doing this for the joint space, we're just verifying the end of the bone. So now you can see what happens when you don't angle the tube, particularly, right? Okay, so that's the lateral. Now, I'm gonna give you, let me get that big green angled sponge there. Okay. I'm gonna give you a sponge to roll back on. So there's 2 angles to this, by the way. This one's the 45 and this one's the 30. Well, this one's a little weird. Yeah, there we go. This side's the 30, this one's the 45. So I'm gonna use the lesser degree and have her roll back against the sponge. Good. Go ahead and straighten this leg out. Bring your hips towards me a little bit. Okay. One way back. All right. You doing okay, ma'am?
Yes.
You're not really a ma'am, it's probably a miss, huh? I'm the ma'am in the room. Okay, so I'm gonna bring this up towards her. I don't wanna move it too much because we've already got our bucky here, and this bucky is a pain to move. Okay. All right, so now I'm gonna do the proximal hip, the lateral. So this first one is